The environment of care is a set of standards for providing a safe, functional, and supportive environment for our patients, staff, and visitors. Any of the 5 elements of environment of care can affect you while you're working: safety and security, hazardous materials and waste, fire safety, medical equipment, or utilities. The Safety Office helps us report and resolve safety issues. The Public Safety Department provides security-related services to our patients, visitors, and staff. All injuries should be reported and documented right after they occur, and reported in the RL Solutions database. The Safety Hotline, monitored by the Safety Office, is available to everyone for reporting safety issues. Each hazardous chemical or product that we use has its own SDS, or Safety Data Sheet. The SDS is where to find info about health hazards and how to protect yourself from exposure. Products also have container and hazard warning labeling. Never deface or remove these labels. The use of tobacco products is prohibited at all Grady workplaces, including buildings, grounds, adjacent sidewalks, parking lots, parking decks, and vehicles. We use a fire evacuation protocol called RACE. Rescue people from the area if they are in immediate danger. Activate the alarm and call 911. Contain the fire if possible. Close doors to the corridors. Extinguish if possible. Evacuate if necessary. At Grady Hospital and Crestview Health and Rehabilitation Center, we practice horizontal evacuation, which is when you move from compartment to compartment. The double doors are fire doors and will protect you in the event of a fire. If you're in any of the main campus buildings or off-campus buildings, you'll evacuate vertically, meaning everyone must leave the building. A fire extinguisher can be used for small fires, and we use the PASS protocol. Pull the pin, aim at the base of the fire, squeeze the trigger, spray in sweeping motion. All medical equipment must have a label that shows whether the device is inspected at a prescribed frequency, only when a failure occurs, or that it's not owned by our facility. Every piece of medical equipment gets inspected. A sticker shows when it was inspected last, and when the next one is due. If it's overdue for inspection, or doesn't have a sticker, don't use it. Unfortunately, there are times when pieces of medical equipment may cause patient injury and even death. In the event of patient injury or death while medical equipment is in use, stabilize the injured. Secure the area. Leave the equipment as found. Don't change any settings. Notify your supervisor immediately. Contact the Risk Management Department at 5-7701. Contact the Clinical Engineering Department at 5-3941. And document the incident in the RL Solutions database. In the event the hospital loses power, we have generators to keep critical medical equipment and communication tools going. Emergency power is provided through red outlets and switches. Medical gas alarm panels are located near the nurse's station. If the alarm sounds, notify facilities management at 5-3960, 24/7, 365. In the event of a fire, only the most senior clinical professionals or unit directors are authorized to shut off medical gases.
Dr. Jones, we have a fire in our wing, and I just got off the phone with emergency management.
What did they say?
We need to evacuate. We're in Wing A, and we need to follow the protocol for a horizontal evacuation and move the patients into Wing B.
Let's go.
When we understand how to recognize, report, and resolve safety issues, we can provide a safe, functional, and supportive environment for our patients, staff, and visitors. Thank you for participating in our Environment of Care module.